Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
Welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. For our radio audience tuning in at WYAD 94.1 FM and WYADonline.com, we're glad that you all can be with us. Also, tuning in online worldwide, thanks for our podcast at iHeartRadio and Amazon Music. We're glad you all could be with us as well. This is part of our Music and News segment here at WYAD, and today we're talking about something that I think impacts more people than we realize, and it's something that I think is important to raise awareness about, and that is about a skin condition called GPP. Here to talk to us about it today, we're excited to welcome Dr. Bruce Strober to our broadcast. Dr. Strober is a clinical professor of dermatology at Yale University School of Medicine. We also have joining us today Brandon, who's also living with GPP. He's going to talk to us about his experience and, of course, the importance of raising awareness as well. Thanks to the two of you for the time today. Really do appreciate you stopping by.
You're welcome. Thank you. Really great to be here.
Look, the pleasure is definitely all mine. Dr. Strober, I want to begin with you. As I mentioned, today we're talking about GPP. For our audience out there that may just be finding out about it, what exactly is it? And talk to us about how it's diagnosed.
GPP stands for Generalized Pustular Psoriasis, but it's different from run-of-the-mill plaque psoriasis that we more commonly experience in our society. GPP is rare. It's a chronic skin inflammation that comes and goes. It's sparked by flares, and the flares are described as red rashes on large portions of the body, widespread. And in those rashes are pus pimples, pustules. People with GPP and undergoing a flare often feel a lot of skin pain, tenderness, soreness, and they experience fever, chills. They have arthritis sometimes. They may need to be hospitalized. That's the key here, because untreated, a GPP flare may result in mortality. And that's why it's important to diagnose it and appropriately bring effective therapy to bear on it.
Dr. Strober, you brought up a really good point. I know for our audience, we've had individuals talk about plaque psoriasis on this broadcast, and I appreciate you showing that it is different than that. So is it? You also mentioned, though, that GPP is rare. Is it also why it's often misdiagnosed?
Exactly. It's misdiagnosed because most doctors never will see a case, and even dermatologists who are trained on GPP might see at most one case every year. So a person who walks into the office with signs and symptoms of GPP might not immediately be diagnosed. There might have to be tests run, like blood tests, and in particular, a skin biopsy, where a piece of skin is taken and looked under the microscope to really nail down the diagnosis.
Well, Brandon, as we are talking about this, and I always try to remind our audience, these aren't just stats and statistics we're talking about about people's lives. As I mentioned, Brandon, you were actually living with GPP. Talk to us about, if you don't mind, what it was like for you when you were diagnosed and how it's kind of impacted your life.
I was a very rare case. I had my first flare-up when I was only 11 months old, so I was just a baby. It started out on my chest and quickly overnight spread to my back, and with high fevers, I was rushed to a children's hospital. From there, I was there for many months with dozens of doctors all coming by, running tests and trying to figure out what was going on with me. And it was just such a rare skin disorder that it took time, and, it's been very hard dealing with it because the lack of knowledge that's out there and information with GPP. So finding the right treatment hasn't been easy, and I've had to go through many different forms of therapies to, finally find something that works to help manage my GPP.
Well, I appreciate you using your platform to be able to raise awareness. Brandon, Dr. Strober, I want to ask you, Brandon mentioned that he was diagnosed with GPP at around 11 months old. What age are people typically diagnosed with GPP?
Typically, it's middle-aged adults in their 40s and 50s, but that's not to say it can't appear in younger people like Brandon or older people. Kind of an equal opportunity condition, like all psoriasis really is.
Wow. So, Brandon, I want to ask you, one of the things that you are doing here with Dr. Strober is raising awareness. How does the Unwearable Collection capture your experience of living with GPP?
The Unwearable Collection is absolutely fantastic. There are 5 different statues or designs that you could call them, created by Bart Hess and the Art Institute of New York. Each one of these installments represents a different part of living with GPP, from the severity of your GPP and the flare-ups to the dangerous, deadly aspects of, having it and being untreated, to the uncertainty of, not knowing what next week is going to bring or when the next flare is going to happen. It's a great way of catching people's eye and then helping, the average person discover about GPP with how uncommon it is. So it's nice to see a artistic platform to draw people's attention in.
Well, Brandon, considering that this is something that you have been dealing with, the majority of your life, I want to ask you about important conversations, and we talk about this on this platform a lot, about talking with their doctors. How can patients work with or partner with their doctor to treat their GPP symptoms, and what do you normally suggest that people's conversations are like when it comes to those conversations?
I mean, the main thing is you just have to be really open and honest about what you're going through. Everybody with GPP, goes through something a little different, from whether they get a correct diagnosis right away, or sometimes it may take a while. But you really have to work with your dermatologist and your primary health providers and just, find a path that works for you. I've gone through many different drugs and therapies to finally find something that worked for me to help manage it. But I think the number one thing I can try to put out there for anybody dealing with GPP is just to try to stay positive and know that, things will get better. Sometimes they're going to be difficult, but as long as you can try to stay positive with it, it will be a lot easier.
Love that. Well, I appreciate the two of you helping to raise awareness with GPP, and Brandon, I definitely appreciate you sharing your story with us as well. Again, everyone, Dr. Bruce Strober has been our guest, and Brandon A. He's been talking to us not only about his own experience with GPP, but Dr. Strober sharing with us, of course, what you need to know about it. Dr. Strober, I want to wrap up with you here. Where can our audience go to be able to learn more?
Well, there's a great website, gppandme.com, has patient experiences, information about the disease, and actually a link to a great video about the Unwearable Collection.
All right. Well, thanks to the two of you again for the time. Really appreciate it. Looking forward to having you back on the show again.
Thank you.
Thanks for having us.
Hey, glad to do it. And we thank your audience for tuning in to another great segment of Conversations Live, again, part of our Music and Youth segment here at WYAD. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Let us go make today amazing. Take care.